work group meeting. Really pleased that you're joining us, and looking forward to a great discussion today. And I hope we can get to everything on our agenda, but I think it's going to be a very robust discussion. So to start with, I wanted to introduce Jillian and our partner from Poland, who I don't think is able to join us for this particular meeting. And it sounds like Jillian is having technical difficulties. So maybe when she's able to join us, we can turn to Jillian briefly.
Kathy, you hear me?
Yes.
Yay, I don't know what happened, but thank you for whoever fixed it. I really appreciate it. I was like, this is not going to be a very beneficial meeting if I can't chime in. So I'm here.
Well, thank you very much. Can I put you on the spot now? And at our first meeting, everyone was able to introduce themselves and share their research interest, especially for this group. So would you mind catching us up on all of that for you?
Yeah, and I did read the notes, so I read all of your introductions. I'm really sorry I missed it. I had a conflicting webinar that had been on my calendar for a long time. So I'm Jillian Schauer. I have a PhD in behavioral science and a master in public health. I've been in the drug policy realm for a couple decades, working first on tobacco prevention and control, and then came into the cannabis space around 2012. And I'm the executive director of the Cannabis Regulators Association and also have an affiliation with the Addictions, Drug and Alcohol Institute at the University of Washington. I have lots of research and policy interests because I get to work with all of the regulators, and pretty much anything under the sun on this topic is of interest to me. But on a personal note, I'm very interested in consumer safety issues and continuing to make sure that products that consumers have access to in the regulated marketplace are safe, and that they are able to trust that those products are safe for them to use. So that's probably first and foremost for me personally.
Great. Thanks so much, Jillian, for that. All right. So briefly, just want to touch on our minutes from the last meeting. I distributed those a couple weeks ago. If anyone has any changes or concerns with those, feel free to say something now. Otherwise, we'll just kind of move forward. But just want to briefly touch in. Everybody okay with those minutes? Anything we forgot to add, or we should strike? Everybody okay? Thumbs up, maybe. If we want to use emojis. If you're not on camera, okay. All right. So we'll go ahead and accept those minutes, and then move into our discussion. And that was a discussion around developing a working definition for this group for purposes of discussion around the definition of cannabinoid. And we've had some really good discussion in our preliminary email exchange to this meeting today. And I am going to share the whiteboard containing all of the great feedback that we received from all of you around this. And I apologize if some of this is a little small. Let me see if I can make it a little bigger now that we have the whiteboard. But there's a lot of discussion, a lot of really robust discussion and interesting discussion and ideas around defining cannabinoid. And let's just take a minute to if we'd like to read through some of these, even though I'm sure some of you have been following the email string. But I just want to kind of kick off the conversation there. What I saw in the discussion was a little bit of, should we go with a scientific definition? Should we go with a more policy-driven definition? Should we go with a short, long?
It's not showing for non-members of the organization.
Yeah, it's just showing in progress.
I don't see it there, Kathy. I just thought
you're not seeing it? Oh, shoot.
I thought it was just me, but
No, it's
saying
not.
something. Let's try it again. Thank you for. Can you see it now? Oh
It's
no.
loading.
I think it might just be internal people because I can see it, Kathy.
Okay. So maybe it is internal. So my apologies to everyone. I had hoped that would work differently. Darn.
Might be to put it in the chat, but maybe not.
Well, yeah, Jillian, I wish we could use Zoom, but it's not an option for our agency. So, you know, since no one can see this except internally, and let me see if there's another way I can share this. Bear with me here for a moment.
Hey, Kathy, I can jump in and I can send you a screenshot of this in a Word document so then you can still share your screen and we can see all of these little Post-it note looking things.
That's a great idea.
Okay, I'll get right to that.
Okay, thank you. So I'll stop sharing. But what we were seeing was a real range of definitions or a range of addressing these concerns, right? Or addressing how we might break down cannabinoids. So I'll just read some of them to you and then Tierney's going to screenshot it and send it to us. But some of the definitions were really simple, like cannabinoids are molecules that share a structure. They're a type of chemical in marijuana that causes drug-like effects through the body. There was the idea of bucketing cannabinoids into phytocannabinoids, endocannabinoids, and other. So I'd like to go ahead and start the conversation there with what do we think would work best for this group, given that this definition is just going to be specific to the work that this group is going to be doing. And I think you saw the bucketed sort of areas of interest that you all had. How can we craft a definition that might serve us moving forward in that work? Go ahead, Chris. I think you might be muted.
Who's that?
Chris, I think you might be muted.
Oh,
There you go.
sorry.
No worries.
As a chemist, I understand the chemical definition, but as a biologist, you need the fact that it binds to a receptor, and that frees you. If you want a legal point of view, you're talking about anything that is going to have that effect, or people are going to be able to step around it. So I think all of these definitions depend entirely on what you want us to do with them. And I think we need the broadest possible definition to start with. And then I think this concept of subcategorizing them, you know, endorphins are clearly not something anyone's going to legislate into. But, you know, endos and synthetic analogs are real problems.
All right, others.
David has his hand up, I think.
Oh, yeah. I agree with what Chris just said. I think that we need to know what the purpose for the definition is going to be. You kind of alluded to that, Kathy. I think if there's like you said, what are we we need this to talk about in this group. So I think we need to define what specific purposes we need the definitions for, and then have a definition that fits each one of those. Goes along with just what Chris said.
Yeah, go ahead, Holly.
I was going to say that I know some of them are defined by states. For instance, in Arizona, which is where I used to live, they defined the metabolite of, for instance, THC, delta-9 THC, as only 11-hydroxy. And that was for the purposes of DUI for people who had medical card. So, I mean, there does need to be some sort of regulatory answer as well. And do we count metabolites as cannabinoids? Because they're not necessarily made by the plant, they're made by the human body. So that's a whole other issue that I'd like to interject. I don't have an answer for it, but I do have a question. So.
All right, let's try to share screen again. Tierney sent me a screenshot of what folks outside of the agency couldn't see. So can everyone see this now?
Sort of.
Yeah, well, zooming in would be helpful. I think you saw.
Yes.
Okay.
We
I
can
thought it was just me.
we just if you made it bigger, then I think people could read it.
Sure. wanted to make sure people could see at all. Okay.
We can definitely see that.
Okay, good.
Yeah, Kathy, I mean, I wrote in, I think it's helpful to know that the definition is internal for the group, although I'm still struggling with sort of what are we going to use it to talk about? Because I think that does matter. And I appreciate the reasons to make it a broad definition, but I think it can get so broad that suddenly there's not going to be clarity about, are we talking about things that come from the plant? Are we talking about things that are entirely chemically comprised? Are we talking about things that have nothing to do with this space that may incidentally bind to the endocannabinoid, receptors? So it still feels very abstract to me. Yeah, I see some other hands, so I'll stop.
Yeah. Go ahead, Jessica, please.
One of the things that there's been a couple other groups that I've been associated with, and one of the concerns with this is that, the CB1 receptor is a little bit loose, I would say. There's a number of compounds that we probably don't need to regulate or think of, like terpenes that bind those receptors. But, on the other end, there's also these compounds people are producing and calling cannabinoids that are probably outside of the scope of what we as a group want to look at. So one of the things that and I'm not sure it's great, have decided on is kind of structure and function being required within a definition. And I don't know how the group feels around something like that, but it is, I think the word cannabinoid in general is something maybe the space is outgrown, but I do understand that we need to probably live within that bounds still.
Right. Anyone else? Chris, I thought I saw your hand up. Did you have something else you wanted to add? Okay. So it sounds like what our definition for cannabinoid in this space is going to depend on how we scope the work that we're doing, correct? And
Yes.
the things that we are going to talk about in the next piece, and that was taking all of your research interest, and it seemed like they fell into 3 separate categories. And so I think the next step for the group is to decide a couple of different things. The first is which of these research interests or which of these concerns are long-term, which are short-term, how we might approach them, and which we're going to start with. And there's several different ways we can do that. We can look at the first bucket where it seemed that there were the most folks interested in the interaction with the cannabinoids in the body, and then cannabinoids as they related to DUI, and then cannabinoids in the regulatory space. And I know there's crossover between all of these, but when we started analyzing all of the different research interests, these 3 buckets became very obvious. So go ahead, Jillian.
Yeah, and I know I missed the first meeting, so I'm apologies for making you potentially repeat yourself, but it would be helpful for me to understand how can this group best support LCB? And if you already talked about that, I imagine this group isn't going to exist in perpetuity. So if we're meeting for a year or something, what is the most meaningful thing that we can do to support LCB? Because in looking at the notes, it looked like there were a lot of great research ideas and research areas, some of which will take, many, many years to look through. And so I'm trying to figure out what's going to have the most impact for you all at LCB.
That's a wonderful question, and I'm really glad you asked it, because I think that's going to help us sort of decide what direction to take here. So thanks very much for that. And just speaking as from a policy and rules perspective, the regulatory pieces are the most important to us at the agency, and they may be for others within the state of Washington as well. But I want to weigh in with the rest of the group on that. Is that a good place for us to start? I know as an agency, that would be the most helpful for us. But show of thumbs, perhaps, if that's the route we want to go down. Okay, I'm seeing thumbs. Virtual thumbs are fine as well. And I have to wonder if there isn't part of cannabinoids and regulation that very, you know, there are connections to effective cannabinoids on the body, and I think that some of this work is going to overlap for sure. And if I'm not reading that correctly, please let me know. But I think that there's a lot of crossover here. Okay. So just reading this subsection, cannabinoids and regulation. So there was interest in the regulatory effects of cannabinoids, regulating components of the plant in a rapidly changing environment to protect public health and safety while supporting industry, regulation of diverse compounds with different risks and rewards, and creating a simple way or scale to express physiologically active and non-physiologically active cannabinoids in end product testing. So that's a really good, I think, sort of kick off bucket to start with. So keeping that in mind and knowing what we just talked about with respect to defining cannabinoid, thoughts in terms of how we might define cannabinoid for a working definition. And go ahead, Holly, your hand was raised.
I was going to say is it's going to depend on which way, because you say regulation. There's several different ways that these compounds can be regulated. You can either regulate them for tax purposes to pay by the unit of cannabinoid in the substance for tax collection, or it can be like a dosage of metabolites in someone's bodily fluids. And those are where the regulation comes in. And since you're a regulatory or working in a regulatory frame, that probably sounds to me like the best way to look at it, as what regulations do we need to work within and make the definition fit that better.
Right. Great points. Jessica, and then Jillian, your hand is raised if you want to. I'm sorry. Oh, okay.
You know, one of the things I think that might be helpful is to define what we want to regulate and what we think is maybe outside of the scope of regulation. You know, this is a rapidly emerging field, and there's a lot of chemistry that's going on that at some point this is no longer cannabinoids, and we may have to say these are what we're interested in, and these other things people are calling cannabinoids are maybe outside of the scope of what we're looking at, would be a suggestion.
Sure. Thank you for that. Go ahead, Amber.
Yeah, I mean, if we're going down this route, I think it might be helpful for us to see current language in regulatory structure regarding this word. I know there's some, you know, obviously reference to it in various WAC codes, and then also I believe there's some potential legislation and that are active that are trying to redefine some of this as well. So getting some examples of how we are thinking about it might be helpful as we move forward as well.
Okay. Others, there are some participants we haven't heard from.
Hi, Kathy. Just wanted to share. I looked up cannabinoid in a lot of the other states that at least had definitions and legal markets. So Oregon, California, Colorado. Most of them essentially defined phytocannabinoid. They essentially said cannabinoid is something that comes from the cannabis plant. I think we've talked about a lot of that. That's not the only cannabinoid that there can be. So I think a lot of other agencies, a lot of other states have kind of put cannabinoid in just that phytocannabinoid box, but I don't know if that's necessarily where we want to be.
All right, thanks for that, Nick. Thoughts on that comment? I have seen phytocannabinoid used as part of the definition for cannabinoid. I think it's in New York, if I'm not mistaken.
You can't define a term with its own definition.
I think one of the biggest issues that we have as far as youth access, in my opinion, and people can disagree with this, is actually from access to compounds that don't naturally are produced outside of the plant. And so things like Delta 8 that the plant can naturally make, but that actually people are synthesizing outside of the plant. That's my personal opinion. Other people could disagree.
Taylor, go ahead.
Just to throw in from like the immunological standpoint. So I work with THC and a lot of its other receptors, as well as endocannabinoids. Some of the stuff behaves differently in the immune system compared to psychoactive. So like THC, the way that it enters into the active site can either be an agonist or antagonist in the periphery. So sometimes CB1 antagonists mirror what I'm seeing with THC versus agonism that you would obviously expect in the brain, in the nervous system. So I think one thing to kind of keep in mind with natural, non-natural, all this stuff is the way that it behaves in the immune system sometimes is slightly different than how it behaves, and the impact that can have developmentally from all aspects, you know, just to kind of keep in mind. And there may be different behaviors of at what point are we focusing more on the psychoactive that we're looking at, since that's more the regulatory, but also to know there's this up and coming immunological standpoint that the impact it can have can be rather large.
All right. Thank you for that. Anyone else in the group?
I guess just to throw in from a behavioral pharmacology perspective, when we're studying novel compounds that we think have cannabinergic activity, or whatever we would call it, cannabinomimetic effects, then we test for 4 things with the cannabinoid tetrad test: its ability to reduce locomotor activity, to produce hypothermia, to produce catalepsy, and what's the other one? Analgesia, I guess, if I didn't say that one. And typically when we're screening new chemical compounds, those are the tests from a behavioral standpoint that we want to look at in order to classify it as a cannabinoid compound. And usually that's through binding to CB1 or CB2 receptors. So thinking about sort of function and structure, I think that was a really good point from Jessica. I think function and structure are both important to consider in the context of the conversation. I think the sticky point is like when you talk about things like CBD, which really doesn't act through CB1 or CB2 receptors, but yet I don't think anyone would take the side that cannabidiol is not a cannabinoid, right? Do we want, so that's where I find, you know, there's a sticking point there, and some of these minor cannabinoids that actually behave more like CB1 receptor antagonists as opposed to agonists. So yeah, it's a really tough answer, actually. It's a really tough question to answer.
Agreed. Others? Oh, you're unmuted. Go ahead. You were unmuted. Did you want to share something? Yeah, no? Okay.
No, sorry about
Okay.
that.
No, that's all right. Just wanted to check in with you. I want to reach out to folks from LCB that are on the call and see if there's anyone who'd like to add to the conversation or offer some insight. I think Nick Coleman provided some feedback. Just checking in with others. Justin has joined us. Chair Volendroff, anything to add?
No, I don't have anything specific to add to this part of the conversation, although going back to earlier when Jillian was asking about the intentions of this group, one other additional item I'd like for this group to consider. So I don't know if this is time limited or what the duration of this is, but I'm really interested in long-term things. So maybe we can be thinking, bucketing, what are some of the immediate things? And you've mentioned, licensing, policy. I'm interested also in potentially starting within the LCB our own research group. And so if we do some long-term research, I would love for this group to help us be thinking about what are things we should be focusing on in the future, as well as the immediate things that would be helpful to the LCB.
Okay, thank you for that.
That's helpful to hear. I was going to chime in and just say I continue to feel like I need a better understanding of what's the charge of this group. Like, is this going to be the place where the discussion about how to regulate hemp-derived products happens? Is this a place where we're just sort of making a bucket list of these are regulatory areas with science underpinning that need to be discussed, and maybe we sort of chunk those into discussions? Or is this the place where we're talking about what long-term research could LCB support that would be valuable to influence policy, consumer safety, markets, et cetera?
Yeah, and going back to our first meeting, Jillian, the basis of this group was really off a bill that did not advance last year from Senator Kaiser that would have established a group similar to this with sort of a similar charge that was a little bit ambiguous. And so what we're trying to do in bringing everybody together and asking for research interest was trying to narrow that down to the extent we could, and then have the second meeting and even narrow those interests down even further. And it sounds like we are going to go on the cannabinoids and regulation side, and then how that, how the group can move forward on that to inform some of the agency direction and perhaps beyond that as well. But I think the parameters of the group are pretty pliable, actually, so that we can take a couple of different directions if we wish, and even create subgroups if we wish. So I hope that helps a little bit. Go ahead, Chris.
What does the it's not really for, I think everybody on the committee wants to help. And the question I think that really is, what does the board need? And, what, I think we're all perfectly willing to help. And I think the number of the aspects that we can cover within the board is really quite formidable. But the board really has to say, we need help understanding how to deal with, Delta 8. We need help understanding on what level could we or should we be dealing with CBD. I mean, these are the things that, people have touched on in the last 10 minutes. But it's not a matter of, you're never going to want, I'd be happy to offer research projects, but I don't see why you should care about my research projects. We need to help you. What do you need? Can the board be very specific?
So reaching out to others on the call. Again, the purpose of this group was pretty general. Let me bring up the charter and see if that helps with this conversation a little bit. So give me a moment here. And it will take me just a moment to bring that up.
Kathy, am I remembering this right? Did this bill come out of kind of the discussions last year around impairing? Am I remembering that right?
Yeah. So I'm going to share my screen really quickly here. Hopefully. All right. Can everybody see that? All right. So
Yes.
the objective was to collaboratively and transparently explore and build foundational understanding of the plant. And that's the definition of cannabis in Washington state statute. And the group responsibilities may include reviewing and discussing available research data and regulations related to cannabinoids, and providing recommendations on potential guidelines for safe methods of manufacturing, extracting, and synthesizing cannabinoids. And the board did review this charter. If you'd like additional clarification, I can certainly return to the board and ask for something more specific. Any additional?
No, I can deal with that. The word equivalence is one that you can equivocate on, but but that's actually very clear. I'm sorry that I missed it the first time around.
Oh, no worries at all. I'm glad we could revisit it. I'm glad we could revisit it. So with this in mind, and based on the conversation that we've had so far, and thinking about some of those items in the regulatory bucket, do folks want me to bring that up again to refresh memories, or do you have it on your screens in front of you or what would be helpful here? Because I can bring it back up again.
Could you please bring it back up? I think it'd be helpful.
Okay, let me stop sharing here for a moment. And, all right, ready? Sharing again. Okay. So with that as a backdrop, looking at, revisiting the charter and turning back to the agenda, well, one of our goals today was kind of scope this work and talk about long-term, short-term, things we can tackle long-term, towards the end of our sessions, right? And we are going to meet every other month for a year. And things that we could work on more short-term. And looking at that third bucket, in people's minds, what might be short-term projects and what might be longer-term projects?
Yeah, Kathy, I mean, I think it's probably on all our minds. The discussion about hemp-derived cannabinoid products is very short-term, and there are any number of definitional issues that this group could talk about. But there was already the Hemp and Food Task Force, there's already draft legislation. So I'm not sure where to plug in to be helpful and not sort of roll the cart backwards down the hill.
Sure.
Discussions are going to be valuable for our state and also, frankly, nationally, right? This is the year when the Farm Bill reauthorization is going to happen. And, to some degree, that could override whatever states have done anyway. So I could see that being a very valuable exercise, but I'm curious what others think because there's already been some discussion. I think there are likely to be areas where, in a very civil way, we won't all agree on definitions. And I don't know that that's necessarily productive to continue to highlight where there are differences if there's already been a consensus building effort underway in the state. But that strikes me as the most urgent sort of short-term objective here.
All right. Others' thoughts? Thanks for that, Jillian.
I think maybe possibly having an overview of what the different, and Nick touched on this a little bit, Jillian touched on this a little bit, that there's been, the Hemp and Safety Food Task Force, there's been some regulation proposed, there's already some statute on definitions, and maybe getting like a little summary for the group to review, and maybe trying to understand like what we believe should be included and not included in a definition to start with, maybe a good starting point. But I don't know, would be a proposal I'd toss out.
Sure, and that is work that can be done in between meetings for sure. For sure. Others?
Yeah, I was gonna jump in real quick. The quotations you have in the charter is almost the definition that we can use for cannabinoids, right? It focuses in, and if we're saying, the cannabinoids created by cannabis and their synthetic equivalents, then we kind of know which ones we want to talk about, or the quote unquote cannabinoids for this group.
Great, thanks for that. And still kind of focusing on short-term goals within that regulatory bucket. Heard something from Jessica, heard something from Jillian, others.
I don't know. I find it hard to have a conversation about regulation of diverse compounds when we just don't have any research to base any regulatory changes on. Like we're pretty confident and have been for quite a while that delta-9 THC is the primary psychoactive constituent. It's the one with the abuse liability. It's the one that is the problem, right? That everyone thinks is the problem. All of the other minor phytocannabinoids, apart from CBD, which has been shown to be relatively innocuous, have really not been shown to have much in terms of abuse liability, in part because the research just hasn't been done. But it feels difficult from my perspective to offer regulatory advice on compounds that don't have any evidence to support them being regulated.
Gillian, please.
Yeah, I agree that we're lacking the science, but I think we're in a reality where policy is already happening. And so we have to do the best we can to discuss the science we have and to use the science we have to make extrapolations. And, the research on a lot of the minor cannabinoids has been done with the levels at which they exist in the plant. It's not been done at the levels with which they're being extracted and put into products. So I still think we need to do our best to bring science to policy. If we waited until we had sufficient science to make policy, none of this would be happening. And that's not the reality. Policy is happening federally on hemp. So I would argue that we need to get around the table and use the science we have to have some thoughtful discussion, even if it's woefully inadequate science at best.
All right, thank you for that, Jillian. Amber, I think your hand was raised next, please.
Yeah, I just want to kind of add on to what Jillian said. These minor cannabinoids are now being either converted or being extracted and isolated and added at higher concentrations in legal products. And so understanding, we don't have a great understanding of the science of people being exposed to them at higher levels at this point, but but they are being added to products that people are buying. I'm not necessarily terrified in that regard, but I think we should be aware of what's out there and be conscious of it at the very least.
I would totally agree with that. I think we need to be aware of it. I still have a problem. I mean, there have been additives to e-cigarettes and all of these sorts of things that have been far more insidious and shown direct health effects that need clear legislation and regulatory action immediately, sort of thing. I just don't know how we regulate a compound like CBC, for instance, when there's literally no research that's been done on it, just because it comes from a cannabis plant. I mean, several terpenes are also naturally produced by a cannabis plant, but we're not talking about regulating terpenes right now, are we?
I mean, I don't know if anybody's talking about regulating or banning these types of substances. I think we're having a conversation about what we know about these in the plant and in products that are available.
Jillian, your hand is still raised. Do you wish to? Okay, sorry, just checking in. Tracy, please. Good to hear from you.
Sure. I guess I would just say also that regulating doesn't necessarily mean prohibiting something. And I think that's pretty clear or important to, talk about at some point. I mean, it can mean providing for appropriate testing and labeling that actually lets the public know what they're getting, but they still can get it.
And if I could kind of follow up with that, maybe one of the things that we think about when we're talking about short-term goals, long-term goals, in terms of what we approach here, let's define what regulation means. I think that, and to your point, Ryan and Tracy, maybe we need to scope, the parameters of regulation. Just a thought. I will stop there. Jessica, go ahead. Your hand was raised, and then after you, Holly, please.
So just a quick comment. I think the other thing that is part of the charter is the manufacturing of these. So we have to also step back and say, like, we know Delta-8 is a pretty benign compound based upon the pediatric studies. We don't know that, I mean, it can make you high, but it's not like, it's like Delta 9. But we don't know that when you manufacture Delta 8 synthetically, if it's safe. And so we have to look at the compound and then also how people are making that compound, is, I guess, the point I would say.
Thank you very much. Holly, please.
Okay, so I was thinking about something, at least in my own experience from the toxicology point of view. Like when we test people or used to test people for cannabis use when it was completely illegal everywhere, what they said was chronic use was 2 to 3 times a week. Now, I'm aware of people who are medical cannabis users that use it 2 to 3 times an hour. So how do we determine when people such as that are impaired beyond, whatever is legit to drive a car, for instance, or, to operate machinery? We don't have anything defined that way nowadays in that perspective of the new reality of legal cannabis.
Thank you. David, please.
Yeah, Holly just got me thinking of some other things, really good points there, something to really think about. Mine was back to actually what Jessica said, and that is that, how the compound is generated is something that really is critical in this understanding. We got several chemists here. We all understand what happens when you chemically transform something, as is commonly used in the vernacular here. There's lots of things that can happen. You get side reactions. None of that's being looked at. We all know the recent, letter again by the FDA saying they're not going to touch this again. They said that again, right? They're hands off. They're just not going to be regulating this at this point. So if any state like ours are going to allow these products to be available to people, it's kind of incumbent upon the state to determine, what is safe and what types of processes that occur or are allowable with the generation of these products. All of that needs to be looked at. And I think, to go back to what Ryan said, very, very little research has been done in those areas. So we really don't know the answers to a lot of these questions that people have. When you talk to legislators, they want a short, 3-sentence answer to things so they can, quote, understand it. And I understand that perspective, but there is no such thing as that kind of an answer. And it's really difficult in being able to talk to people that are making these policy decisions based on no information. How do we generate the information that can actually help them make better decisions that are really going to be helpful for everybody? That's something that I think we need to really think about how we can do that. That's a big challenge, though. It's a real challenge to figure out how to do that.
It is, and I would say, I'm hoping that's something that this group can sort of explore. How can we present that information and be as helpful as possible? Before I call on you, Tracy, Jillian, your hand's been up for a while.
I probably don't know how to lower it, but I was just
okay.
Yeah. I was just going to chime in and say, I think there's that the production and manufacture of the products is really important. And if we're lacking the science to say what we think is safe, I think one of the things this group could do is discuss other ways to assure consumer safety in the absence of science. What does that mean? Is it taking a precautionary approach? Is it having some thresholds? I mean, I think that would be a valuable discussion. I'll try to figure out how to lower my hand now.
Okay, no, it's okay. It's all right. No worries at all. Tracy, I wanted to call on you since you had your hand raised as well.
Just really briefly, I mean, most of the points have been said, but just to, again, reemphasize that the lack of information is, at all levels. And I mean, I think we have to also kind of figure out who the audience is. I mean, typically regulations are there to protect the public. And so we can assume that our audience is perhaps the public that doesn't have much background or education at all. But we also have to at least provide some support for people who do. And perhaps there will be some ancillary documents that will come out of this task force.
Yes, agreed. If I may, I'd like to read something that Richard put into the chat. He says, not only are minor cannabinoids being synthesized and sold, in just a moment, to consumers, but the synthetic side products that are present in these synthetic substances are new chemical entities that have not been previously reported. We're testing consumer products that contain new chemical entities in higher abundance than the target substance that's named on the product label. We're also seeing mixtures of TLC, and I think you're meaning THC. I might be wrong, but homologs and their acetates. And then Jillian responds, and this is for folks that might not be watching this and it doesn't come up on the recording, but very important information. Thanks for sharing from Jillian. So we've only got 2 minutes left before we wrap up. I want to switch gears, and we've talked about short-term things, short-term items in the cannabinoid and regulation bucket. Long-term things, and I know we've got just a very short period of time to do that, but want to weigh in with folks on what might be long-term goals that we want to think about, or long-term issues that we want to think about.
I'd like funding on there. Thinking
Funding?
about how we fund future research.
I saw a finger wave from Amber on that one, so thank you. Go ahead, Amber.
Yeah, I was gonna say harmonizing testing standards and harmonizing regulations across states is direly important, as the feds are not going to move on this for quite some time.
All right, Jillian, is it a real, truly
Yeah,
a hand raise? Okay.
It shows my hand gets lowered, but maybe it doesn't show on your end. I'm having all sorts of problems. Yeah, I was going to echo what Amber said. You know, on my mind is the sort of future of interstate commerce, and I think there are any number of areas that Washington should be talking about to prepare for that. But on the science side, harmonizing the lab testing, the product safety standards, figuring out what that looks like, I think is of critical importance. I'd also be curious to hear from the board. I think the idea of considering how Washington does more to support research is really important, and we've seen a number of other states move in those directions. I'd be curious to sort of hear what the board's thoughts are on that, and what, if any, areas the board is interested in.
Thank you very much for that. Holly, your hand is raised. Go ahead.
Across state labeling, like product labeling, because I've gone between Arizona and California, and the disparity between all the different products, even amongst the products in a single state, it's just confusing, and there's no uniformity in that. And especially if it does become a national market, that's got to be something that's probably put into place sooner rather than later.
And I'll just chime in and say that that's an issue at the Cannabis Regulators Association that we talk a lot about. And there are a lot of challenges to any one state harmonizing that, and even to multiple states coming together and saying, we think this is what good would look like. The packaging and labeling standards come through state legislatures. So you'd effectively have to get every state legislature on board to make changes there. Not that this group couldn't put forward recommendations based on science about what we think would be good, you know, to be considered from Washington State's perspective, but the harmonization piece is a very challenging one.
Definitely is. All right, so I'm going to stop sharing my screen. And I want to just take a moment here before we close to check in with Board Member Vollendrop and perhaps Justin Hordhorn, who's our Director of Policy and External Affairs. Any parting or closing remarks that you'd like to make before we conclude the meeting today?
I just want to thank everybody for the fruitful conversation. I think that there's a number of things to consider, and I want you to think about the desire that we have to use science and research and to help with policy decisions. And the lack of information is the problem. And so the lack of good research is the problem. And when we're faced with making policy decisions, we sometimes have to do that with what we have available at the time. And so I get that there's not adequate research in this area, and that's the value of having this group. And to the degree that this group can, again, help us shape what that could look like within the LCB in the future would be super helpful. So thank you.
Sure.
Yeah, I would
Thank
add,
you.
just thanking everybody for your time in the conversation. Really good conversation today. And as you heard earlier, we're looking at setting up a research program within the LCV. And so hearing the questions that you all are presenting really is going to help also form how we want to develop that program and take a look. And we're kind of at the beginning stages of that. So listening to all the questions that you have is going to be really helpful. We may not have answers yet, but that's okay. You know, and I think that the conversations are going in a very robust manner, and I think that this is going to be really have a lot of value added for us, even if we can't identify what that looks like exactly right now. I can tell that this is going to be very beneficial for us. So I really appreciate everybody taking the time to participate in the meeting.
Great, thank you very much, Justin. I just wanted everyone to know that Chris Beecher had to leave a little bit early, so that's why he wasn't engaging in the conversation anymore. So just wanted everyone to know that he was still interested, but he had another obligation he had to leave for. So for next steps, we'll go ahead and put meeting minutes together. Sounds like there is a little bit of homework that I will do for the group and get back to everyone on, and then hoping that in between our meeting, we can have some more discussion via email on what we can do to have a super productive next meeting in April. Is it April? Yeah, April is the next meeting. So looking forward to seeing everyone. And thank you again for your commitment to this work, for joining us for an hour out of your busy schedules to have these really important conversations, and look forward to seeing you next time. So anything in closing, my co-chair Holly, anything you'd like to offer before we sign off?
No, other than the conversations that we have in this group are fantastic, and it takes me so long to soak them in.
Good to hear. The recording will be up, and thank you for that, Holly. Appreciate it. Recording should be up on our website, our external website, probably in a couple days if you want to revisit it. But in the meantime, looking forward to seeing you in email, and we'll see you next time. Take care, everyone.
Thank you.
Thanks all.